Leader of the third party.
Mr. Speaker, the Fredericton and Upper River Valley area is desperately short of psychiatrists. In 2015, there were 2,000 admissions to the emergency department at Chalmers and the other hospitals for mental health concerns, and that's jumped 2 years later to 3,000 admissions. The government has also established some new mental health programs in the past year or so, but they have not invested in the necessary staffing to make them run, to provide psychiatric resources. The problem in this region, Mr. Speaker, is there are no billing numbers, there are no Medicare billing numbers left to hire psychiatrists, despite there being psychiatrists who have indicated they want to move to the region and work here in Fredericton and in the Upper River Valley. The system is bursting at the seams, Mr. Speaker, and people are needlessly suffering with mental health challenges when that need not be the case. Will the Minister allocate more billing numbers to the Fredericton and Upper Valley region so there are enough psychiatrists to treat the New Brunswickers who are forced to go without?
The Honourable Minister of Health.
Merci beaucoup, Monsieur le Président. Écoutez, moi, je suis content de parler d'initiatives que nous faisons au niveau de la santé mentale ici dans la province du Nouveau-Brunswick. Je sais qu'au niveau, nous avons annoncé évidemment des spécialistes, davantage de spécialistes qui vont être dans le système. Et puis, nous sommes en train d'évaluer lesquels spécifiquement seront selon les différentes régies régionales de santé, selon les besoins identifiés par ces régies régionales de santé. Je peux aussi vous parler des plusieurs initiatives en santé mentale que nous avons fait, tout ce qui concerne au niveau des écoles, au niveau des services intégrés, tout ce qui concerne aussi le mentorat des pairs également, qui fonctionne très bien. Nous avons également toute une nouvelle stratégie par rapport aux dépendances. Donc, toutes ces réalités-là au niveau de la santé mentale, nous allons de l'avant avec ça. Nous jugeons que la santé mentale est une priorité pour notre gouvernement. Nous allons continuer à investir à ce niveau-là pour faire avancer la situation. Merci.
Leader of the third party.
Mr. Speaker, the Fredericton and Upper River Valley Health Region is about 8 psychiatrists short and is being, in fact, treated unfairly compared to the numbers of psychiatrists in St. John and Moncton, where both regions have many more psychiatrists for the population. For example, in this region there's a pressing need for another position in the child and youth psychiatry. In 2012, there were just under 200 new referrals to child and adolescent psychiatry. By 2016, that number of referrals had leaped to more than 310. Now, children and youth, considered medium priority, are waiting 6 months or more for an appointment to see a psychiatrist, Mr. Speaker. I can't imagine how frustrated and worried their parents must be. Will the Minister answer this simple question, and that is to make the necessary billing numbers available to this region to provide the psychiatric relief that so many are desperately seeking in Fredericton and the Upper River Valley?
Honourable Minister of Health.
Thank you very much, Mr. Speaker. Well, when it comes to billing numbers, I'm happy to report that we have announced that we will be adding billing numbers within the system. And those billing numbers include specialists. We will let the regional health authorities determine where the priorities are. As the member opposite has often asked questions on other situations regarding other specialties and other areas of health, he knows full well that there are many areas that we have challenges, and we acknowledge that. So for those reasons, we let the regional health authorities make that determination where those billing numbers will go. We, of course, we will work with them. We will work with the regional health authorities to make sure that the appropriate billing numbers go to the appropriate places where the need is the greatest, and we will make sure, once again, that New Brunswickers are best treated when it comes to mental health care. Thank you.
Leader of the third party.
Mr. Speaker, the reason there's so much competition for things like billing numbers is because the cracks in our healthcare system have been widening significantly. If you look at the Upper River Valley, children and youth wait over 8 months to see a psychiatrist, while the wait time for adults is 13 months in Woodstock, 17 months in Perth. So these cracks growing in our general health system and our mental health system are swallowing people whole. Government's been creating new programs, yes, but it's more like checking off boxes, Mr. Speaker, when they don't provide the necessary resources to ensure that the integrated service delivery is properly staffed, to ensure that the new psychiatric mental health teams are properly staffed. They're drawing away from the work of other psychiatrists and other specialists, so they're unable to do the work adding to these wait times. So, Mr. Speaker, this is checking boxes, not good governance, not good administration, not good management. So the question is, specifically, will the Minister release the Medicare billing numbers needed to fill
Time
the
member, the Honourable Minister of Health.
Yes, thank you very much, Mr. Speaker. Well, once again, I can only repeat that we are adding new billing numbers to the system. And the RHAs are responsible for determining where the priorities lay. We will work with these RHAs to see how we can better serve the population of New Brunswick. We do acknowledge that mental health care is important to New Brunswickers. Good mental health is good health, and I can certainly acknowledge that. As my mother is a retired mental health nurse, I certainly understand the value of that. So I can assure you that we are closely looking into this situation, making sure that mental health and addictions in New Brunswick is treated with the utmost standards to make sure that patients are being cared for at the best time possible by the appropriate care provider, and to make sure that New Brunswickers are in the best mental health care possible.
Member for Moncton Southwest.
Thank you, Mr. Speaker. Will the